In this video, we will be discussing about bronchopulmonary segments. So, bronchopulmonary segmental anatomy describes a division of the lungs into segments based on the tertiary or segmental bronchi. Each segment, it has its own pulmonary arterial branch, and thus the bronchopulmonary segment, it is a portion of the lung which is supplied by its own bronchus and artery. Now each segment, it is functionally and anatomically discrete, allowing a single segment to be surgically resected without affecting its neighboring segments. In general, each lung, right lung have 3 lobes, left lung has 2 lobes, and each lung they have 10 segments. The upper lobe contains 3 segments, the middle lobe, and on the left side there is a lingula which has 2, and the lower lobe have 5 segments. So bilaterally, the upper lobes have apical, posterior, anterior segments, and the middle lobe have lateral and medial. The right lung, on the lower lobe, there are 5 segments: superior, medial basal, anterior basal, lateral basal, posterior basal. And on the left side, again the upper lobe, it has 3 segments: apical, anterior, posterior, and instead of having a middle lobe, there is a lingula, and lingula is further have 2 segments: superior, inferior. And the left lung, the lower lobe, again have superior segment, medial basal, anterior basal, lateral basal, and posterior basal segments. So bronchopulmonary segments anatomy is important if you need to learn about the postural drainage, or sometimes in short questions the bronchopulmonary segment question is asked directly.